Hi and a very good morning. This is Yatharth Pannu, and I'll be presenting on the topic oral mucosa and its comprehensive overview and a detailed analysis on how it functions and its various parts. So the oral mucosa, it is the moist inner lining of our oral cavity. Mucosa is generally moist, but in typical over here, we are talking about the oral mucosa that is present in our oral cavity. So its crucial functions include protection. Protection could be from chemical and physical agents, insults, and trauma. Sensation, our taste buds. Our taste buds give us sensation of taste. So we include that in our oral mucosa. Secretion of saliva. Thermal regulation. Thermal regulation is not quite prevalent in humans as a species, but in dogs, for example, it's quite prevalent that the oral mucosa of dogs is responsible for thermal regulation. You must have seen panting dogs. And other things we'll be looking into this presentation is its intricate structure, classifications, clinical aspects of oral mucosa, providing a comprehensive understanding of this vital tissue. Okay, let's just progress further. Okay. Hmm. So the functions of oral mucosa, as we discussed earlier, the first function is protection. It acts as a barrier against mechanical trauma and all the microbiological insults. Second is sensation. It detects temperature, touch, pain, taste. Triggered reflexes like swallowing, chewing, gagging, and salivation are also the functions of oral mucosa. Secretions produces saliva, essential for lubrication, digestion, and oral hygiene. Thermal regulation, as foretold, important in dogs but less significant in humans. After that, we come into the classifications for oral mucosa. So the oral mucosa can be classified into three major categories, that is on the basis of their keratinization, function, and location. Starting with the location, it highlights the locations as buccal mucosa, palatal mucosa, lingual mucosa, gingival mucosa, alveolar mucosa, and labial mucosa, where each of the functions is associated with the part labeled. For example, palatal mucosa is hard and it safeguards all the inner linings from getting trauma or like getting injured from any food particle or any hard particles that you swallow. Okay, then the function. On the basis of the function, oral mucosa is divided into three parts: the lining mucosa, masticatory mucosa, and specialized mucosa. Lining mucosa covers 60% of the oral cavity, whereas the masticatory mucosa covers only the 25% of the oral cavity. Specialized mucosa comprises of your specialized papillae that are present on the dorsum of the tongue. Okay, so this comprises of the 15% of oral cavity. Then comes the keratinization. It's one of the most important classifications for oral mucosa and is often asked, okay, what kind of keratinization is present and whether the mucosa present in a certain structure is keratinized or non-keratinized. Keratinized epithelium is hard, keratinized mucosa is present on hard palate, gingiva, whereas the non-keratinized epithelium is present on buccal mucosa and labial mucosa. Labial mucosa, the mucosa on our lips is non-keratinized. Okay, organization of oral mucosa. This diagram represents the I'm sorry, organization of our oral mucosa. So the topmost layer, as we from our high school days, the topmost layer is epithelium. Then comes the lamina propria. Then the submucosa, and then periosteum and bone continues. We are much focused on the epithelium, lamina propria, and submucosa part of here. So epithelium, the outermost layer. The outermost layer is either keratinized or non-keratinized, as I told you, composed of 90% keratinocytes and 10% non-keratinocytes. यहाँ पे you need to understand that non-keratinocytes is different from being non-keratinized. Okay, keratinocytes are cells, a type of cells present over there. It's none other than association with the surface keratinization. Okay, then comes the lamina propria. It is the tissue, like connective tissue layer directly beneath the epithelium. The topmost layer is epithelium. Beneath it is your lamina propria, providing support and nourishment to the epithelium. Okay, so it's below the epithelium and it just supports and provides nourishment. Then comes your submucosa. It is present in the deeper parts just below your lamina propria. What it does, the deeper connective tissue layer attaching the oral mucosa to the underlying structures. What are the underlying structures we could see here? Those are periosteum and bone. The submucosa layer basically adheres the above lying layers like lamina propria and epithelium to the underlying structures. Okay, there might be some exceptions to submucosa that I'll mention in the further slides. That, for example, the hard palate, the areas of hard palate, the submucosa is absent. Okay, continuing. The turnover period of oral mucosa. What's a turnover period? From the progenitor cells, like from the basement of the cells come up, they rise up, they desquamate, and then they shed off. So the turnover period is when a cell starts from here and it reaches the top. Okay, so the one cycle is known as a turnover period. So the turnover period for oral mucosa has three key points. There is a continuous cell renewal in oral mucosa. Okay, the oral mucosa maintains its integrity through continuous cell renewal, with progenitor cells dividing to provide new cells and maturing cells forming a protective surface layer. So, if it is not repaired continuously, what will happen? It will slowly become weakened and trauma could easily be inflicted on the oral cavity. Second, the turnover time. Turnover time is the amount of time it requires. The time required to replace all the cells, I mentioned all the cells of the epithelium, varies depending on their location. It is 52 to 75 days for skin, 41 to 57 days for gingiva, and 25 days for our cheek. So see, based on the location where the epithelium is present, the turnover time varies. And also you can correlate to like how much trauma or insult a part would be encountering. Then there comes the factors affecting the mitotic activity. What's the mitotic activity? So mitotic activity is influenced by the time of the day, okay, stress, and inflammation. Note that inflammation, the slight inflammation, if it's present, the mitotic activity increases. But with severe inflammation, the mitotic activity decreases at a gradual rate. Okay. Then comes your, let me just move this, tonofilaments and cytokeratins. Okay. These are few like you can say connecting links in the oral mucosa. These are proteins, these can be filaments, and these can be bundle of filaments. These are necessary for us to learn to understand the microstructure of our oral mucosa. Tonofilaments are fibrous proteins forming an important structural component within the cells. Intermediate filaments, a class of intracellular filaments, including tonofilaments. So, intermediate filaments include the above one, tonofilaments. Then comes your more important cytokeratins. It is a class of intracellular proteins, including intermediate filaments. So we are going from up, like tonofilaments is a part of intermediate filaments, and intermediate filaments is a part of cytokeratins. Okay, and then a bundle of tonofilaments, the last one, a bundle of tonofilament is known as tonofibrils. Layers of keratinized epithelium. Okay, so we have already known that there are layers to the epithelium. Then there are the four layers for epithelium. First is your stratum basale, stratum spinosum, stratum granulosum, and stratum corneum. The four layers starting from the lowermost, the stratum basale, the innermost layer containing progenitor cells and maturing cells responsible for cell division. Then there comes your stratum spinosum, a layer of polyhedral cells with tonofilaments aggregating into bundles characterized by spiky appearance due to desmosomal attachments. So it will appear spiky or star-shaped when you observe it under a microscope due to its desmosomal attachments. It's a very important question asked in UGs. Stratum granulosum, a layer of flat cells containing keratohyalin granules, which contribute to the thickening of cell membrane and formation of cross-links between the tonofilaments. Then is your stratum corneum, the outermost layer. Like outermost layer in a keratinized epithelium, it's stratum corneum. The outermost layer composed fully of differentiated keratinocytes. Okay, differentiated keratinocytes. It's different from keratinized epithelium. Okay, fully differentiated keratinocytes containing bundle of tonofilaments embedded into a matrix of filaggrin. Okay, clinical aspects. Okay, clinical aspects of oral mucosa. Oral mucosa can be considered for clinical aspects as its color, texture, and firmness can indicate many things. For example, the color is generally pale pink or coral pink. I'll specify the color. It's coral pink for not Indian civilization, but it is mentioned its general color is pale pink, not pale pink, coral pink, with the variation due to vascularity, pigmentation, and keratinization. So it's pale pink, but the three major like points you will say for the variation in color would be vascularity. Okay, how much veins or your arteries or venules are running across. The more number of vascularity, the rich red color it will give. For example, your lips are bright red. That's due to increase in its vascularity. Then pigmentation. Many people have increased melanin secretions or they have a habit of smoking. That will generally change the color of their mucosa. Then is your keratinization. Texture, smooth with exceptions. The texture is usually smooth with exceptions like dorsum of the tongue, which is rough, hard palate with the presence of rugae, and gingiva, which has stippling. We'll study what stippling is in the further slides. Firmness. Firmness varies on the depending on the location with buccal mucosa and lips being loose and gingiva and hard palate being firm. Okay, the firmness also varies. Okay, then comes your non-keratinized epithelium. We study about the keratinized epithelium. Now it's the non-keratinized epithelium. Okay, this is the second part of your presentation. What is a non-keratinized epithelium? This part of presentation explores the structure components of non-keratinized epithelium, a type of tissue found in various parts of the body, including oral cavity. We will dive into the layers of non-keratinized epithelium, compare it to the keratinized epithelium, and examine the structures of desmosomes. We will also explore the connective tissue that supports this epithelium, including its cells, fibers, and ground substances. Finally, we will discuss the basement membrane and its role in connecting the epithelium tissue and underlying connective tissues. So desmosomes, I did tell you desmosomes are important when I told you the spiky appearance of stratum spinosum. Okay, layers of non-keratinized epithelium. We studied the layers of keratinized epithelium as stratum basale, stratum spinosum, stratum granulosum, and stratum corneum. Now we'll continue with layers of non-keratinized epithelium. There is a stratum basale, stratum spinosum, but with a change of stratum intermedium and stratum superficial. We'll look into them. The innermost layer, again, the basal is the innermost layer composed of single-layered cuboidal cells resting on the basement membrane. This layer is responsible for cell division, replenishing of the epithelium. It contains two functionally distinct type of cells and tonofilaments. Then is your spinosum. It is also known as stratum filamentosum. This layer consists of 20 to 40 layers. I'll repeat, 20 to 40 layers of polyhedral cells. These cells are larger, rounder, and plumper than those of stratum basale with fewer and less organized tonofibrils. Odorant bodies appear in the upper part of this layer. Okay, so there's a concavity in these cells when you'll see the star-shaped cells, but they have a concavity. There is this odorant bodies are found in the upper layers. It is also one of the most important questions asked. Containing lipids that may contribute to the permeability of the barriers. Stratum intermedium. This layer contains flattened cells with numerous dispersed tonofilaments. Cells in this layer contain glycogen and rare keratohyalin granules. They lack filaggrin but contain loricrin. Okay. As we studied there, it was filaggrin over there. Here, loricrin is present. Protein that contributes to the structural integrity of the epithelium. So over here, the odorant body secreted something, a lipid that contributes to the permeability and the barrier. Over here in intermedium, we are studying that there are filaments, proteinaceous filaments that contributes to the structural integrity of the epithelium. Then is your stratum superficiale, also known as the stratum distendum. This is the outermost layer composed of flattened cells with numerous dispersed tonofilaments, while cell organelles are reduced and the nucleus remains present. Okay, the cell has nucleus, but all the organelles present like mitochondria, RER, all are gone and they become flattened. These cells are not dehydrated, making sure the surface is flexible and tolerant to the compression and distension. Okay. So these cells are dehydrated, like these cells aren't dehydrated. Like they need to maintain the flexibility of the layer and have to tolerate compression and distension. Okay, here's a table showing you difference between keratinized versus non-keratinized epithelium. What are the four layers for the keratinized epithelium? Stratum basale, spinosum, granulosum, corneum. And for the non-keratinized one, it's stratum basale, spinosum, stratum intermedium, and stratum superficiale. Okay, in keratinized epithelium, there is bundles of tonofibrils, and here the bundles they are not present. It is dispersed tonofibrils. Rather, not fibrils, filaments. We will assume, because we studied in the first part of our presentation that a bundle of tonofilaments is known as tonofibrils. And bundles are absent over here, so it will be dispersed tonofilaments. Second, granular cell layer. Keratohyalin granules are present over here, and in the intermediate layer, glycogen granules are present. Here the cytokeratins present 5 and 14, and easy way to remember CK 1, 6, 10 and 16. I used to remember like 1, 6, 16 and 10 plus 6 also 16. And then over here it's 5 and 14. These are the common cytokeratins 5 and 14. Here 4, 13 and 19 are present. Basal basal to prickle movement increase cell in size. Basal to prickle movement increase in cell size relatively more. So when we move from the basal layer to the spinosum, the cell size increases in both, but relatively when we compare both, the in non-keratinized epithelium, there is a much more increase in size as compared to the keratinized epithelium. Membrane coating granules, elongated or filamented, and membrane coating granules in non-keratinized epithelium, circular and amorphous. This is the question asked in my first year. Like the membrane coating granules in non-keratinized epithelium are amorphous and circular. Filaggrin is present in keratinized and non-keratinized filaggrin is absent. Okay. we'll study about structure components of desmosomes. Desmosomes are what? Intercellular attachments. So the three most important terms you'll come across here in desmosome part is transmembrane proteins known as cadherins, cytoplasmic adapter uh, plaques known as catenins, and cytoskeleton filaments. These are the three important words you'll come across in desmosomes. Okay, so we'll study about them. Desmoglein and desmocollin are primary cathedrins responsible for cell-to-cell adhesion. Okay, one cell, two cell, in between there is cathedrins. Okay, in desmosomes. Cytoplasmic adapters or plaques, also known as catenins. So desmoplakin and placoglobulin are the key catenins that link transmembrane cathedrins to cytoskeleton. Okay, so plaque basically what it does over here, you can see in the figure, there is a desmosome and there is this plaque. So what plaque does is ki a cell, and in between there is desmosome. But plaque what it does is it attaches the desmosome to the cell. Then it's the cytoskeletal filaments. Intermediate filaments, specifically keratin filaments, provide structural support and connect to desmosomes through the cytoplasmic plaque. Connective tissue. Connective tissue provides the structural support and nourishment. Okay. So we are done with the epithelium. We are diving into the lamina propria part. As we foretold, there is epithelium, then lamina propria. Lamina propria, what it does, it provides structural support and nourishment to the epithelium. It is composed of two main layers, lamina propria, also known as corium, and submucosa. The lamina propria is directly beneath the epithelium, while the submucosa is in the deeper layers. The submucosa is lesser prominent and absent in masticatory mucosa. Okay. The three important parts or points of connective tissues are cells, fibers, and ground substances. If anyone asks you what are the 3 points, what is present in the tissue, connective tissues, say cells, fibers, and ground substance. Okay, what's the function of basement membranes? The basement membrane is a thin specialized layer of extracellular matrix that separates epithelium from the underlying connective tissue. Okay, so this is a thin layer of specialized extracellular matrix that separates epithelium from underlying connective tissue. It is found in association with various tissues, including epithelial, nerve, and muscular tissues. What is its function? First is bonding. Okay, the basement membrane acts as a strong adhesive and anchoring to the epithelium to the connective tissue beneath. Support, permeability, and cell growth and migration. The basement membrane plays an important role in directing cell growth and migration during development and regeneration and repair. Okay, oral mucosa. Let me just do this. Oral mucosa region-wise description. Okay, we did study uh, the classification points. First was keratinization. Second was what kind of mucosa are present, masticatory, lining, and specialized. Now we also studied the regional variations in the oral mucosa. We'll study them. Your buccal and labial mucosa, floor of the mouth mucosa, ventral surface of the tongue mucosa. Okay. These are different types of mucosa. Buccal and labial mucosa, this mucosa is composed of non-keratinized stratified squamous epithelium. uh, okay, with slender papillae and dense collagen fibers. This is firmly attached to the underlying muscle, and submucosa contains fat and minor salivary glands. Your mucosa on your lip, it can't be hard. Okay, it is very like soft, non-keratinized. It gets easily it gets trauma or easily it gets pinched or bleeding is very easily it can inflict injury over there. Secondly, they are plump. You have heard like plump lips. Why is it? Because they have fat in their submucosa and minor salivary glands are also present. Floor of the mouth. This mucosa is characterized by very thin, non-keratinized, squamous stratified epithelium, and a lamina propria with short papillae, extensive vascular supply. The submucosa contains loose fibrous connective tissue, fat, and minor salivary glands. Okay, very similar. Then is your ventral surface of the tongue. Okay, this mucosa is composed of again non-keratinized stratified squamous epithelium with slender papillae and connective tissue with thin short papillae. The submucosa may contain fat and small blood vessels. Okay, these all three mucosas are non-keratinized. Now here we'll study about oral view of mucosa of gingiva, palate and tongue. Okay, starting with gingiva. What is gingiva? Your gums. Okay. Shift here. Okay. The gingiva is a crucial part of our masticatory mucosa. Masticatory mucosa, why do we name it masticatory mucosa? Because it prevents all the masticatory trauma which can happen due to mastication. तो खाना चबाने से या किसी भी चीज से you can get an injury, उससे it prevents you. Covers the alveolar process of the jaws and surrounds the cervical portion of the teeth. It is divided into free and attached gingiva, each with distinct characteristics. Free gingiva is keratinized but not stippled. What is stippled? It is also known as the orange peel appearance. It appears like an orange peel, while attached gingiva is keratinized and stippled, separated from the alveolar mucosa by mucogingival junction. Okay, if there is inflammation on the gingiva, the stippling disappears or is significantly reduced. It can also be a diagnostic method used in your clinics for diagnosing inflamed gingiva. Attached gingiva is connected to both tooth via junctional epithelium. Histologically, it features a thick ortho or parakeratinized stratified squamous epithelium with stippled surface due to deep retipex. Okay, also the classification of keratinized epithelium, specifically keratinized epithelium, can be done on the basis of orthokeratinized or being parakeratinized. Okay. Main difference is presence of granules in their basal layer. Then there is free gingiva and attached gingiva. Free gingiva is keratinized, non-stippled, bounded by gingival sulcus. Attached gingiva is keratinized, stippled, connected by junctional epithelium. Interdental coal anatomy and clinical significance. Okay, what's the location for interdental coal? Below the contact points of the teeth. What kind of epithelium is present? Non-keratinized, continuous with junctional epithelium, and its susceptibility prone to inflammation due to stagnation. Okay, the interdental coal, it is present between two teeth, two consecutive teeth. Between them, there is presence of interdental coal. It is a valley-like depression of interdental papilla located directly below the contact points of the teeth. Its epithelium is continuous with junctional epithelium and it is non-keratinized. This area is highly susceptible to inflammatory diseases due to its potential stagnation site. Understanding the anatomy of interdental coal is crucial for maintaining optimal hygiene and preventing periodontal issues. Proper cleaning and care of this area can significantly reduce the risk of inflammation and diseases. Okay, then comes your gingival fiber groups. Okay, there is gingiva, attached to is your gingival fibers. Okay, over here also you can see gingival fibers. Gingival fibers play a vital role in supporting the free gingiva, binding the attached gingiva to the alveolar bone and maintaining physiological appearance of the gums. Okay, these are the three main functions of your gingival group of fibers. First is your supporting the free gingiva. Second is binding the attached gingiva to the alveolar bone. Third is your maintaining physiological appearance of the gums. Here are the different types of gingival fibers. These are dentogingival, alveologingival, circular, dentoperiosteal, transeptal, semicircular, transgingival, longitudinal, interdental, and vertical groups of fibers. Each group has a unique origin and insertion point, contributing to the overall stability and health of the gingival tissue. Understanding these fiber groups is essential for comprehending the biomechanics of the periodontium. Here are the 10 groups of fibers and their functions. Dentogingival fibers attach from cementum to gingiva, supporting gingival tissues. Alveologingival fibers connects alveolar bone to gingiva and secures the gingiva. Circular fibers encircle tooth within the free margin and maintains tooth position. Transeptal fibers between the adjacent tooths maintain alignment in the dental arch, whereas the dentoperiosteal fibers form cementum over the alveolar crest, like from the cementum over the alveolar crest, and anchors the tooth. Like it doesn't allow the tooth to dislodge. Semicircular fibers run between different locations on the same tooth. Transgingival fibers extend between teeth within the gingival tissue. Interdental fibers located within the adjacent tissue, adjacent teeth again, and it is present coronal to the alveolar crest. Then comes your longitudinal fibers. They run longitudinally, as their name suggests, along the tooth surface. Then comes your vertical fibers. They extend vertically from the alveolar bone to gingiva. Okay. So the vertical fibers extend vertically from your alveolar bone to gingiva. Okay. Mucosa of hard palate. As I mentioned, submucosa part and other parts is absent in the hard palate. Here we'll study the mucosa of hard palate and structure and its function. The mucosa of hard palate essential for various oral functions. It is distinguished by transverse palatine ridges, such as known as rugae. It's very important in your prosthodontics as well. This word rugae, and a thick, dense collagenous tissue layer. It is thick and orthokeratinized. Often it can be parakeratinized in certain areas, but it is mainly orthokeratinized. Stratifies squamous epithelium and functions as a mucoperiosteum assembly. What is mucosa, periosteum? It's the upper layer of your bone assembly, tightly bound to the underlying bone. This region is divided into distinct zones, each with a unique feature. The unique structures provide rigid support during mastication, protecting the palate from the mechanical stress and contributes to the overall oral environment. The rugae aid in food manipulation and speech articulation, while the numerous salivary glands maintain moisture and facilitate digestion by providing saliva and containing enzymes and antibodies. Okay, so there are many minor salivary glands present on your palate which facilitate your digestion, and it also contains enzymes and antibodies. So it is divided into two parts: anterior lateral part and posterior lateral part. The anterior lateral part of the hard palate has fatty deposits which provide cushioning and support, whereas the posterior lateral part aids in digestion and has many minor salivary glands and maintains a moist environment in our oral cavity. There is specialized mucosa for our tongue. Okay, specialized mucosa of the tongue, as we talked before, the dorsal surface of the tongue is covered by specialized mucosa. Dorsal is this, and ventral is your lower one. It's opposite for the tongue, if you don't remember. Uh, the dorsal surface of the tongue is covered by specialized mucosa, which functions in both mastication and taste. It is divided into anterior two-thirds, papillary portion, and posterior one-third, the lymphatic portion. And it is divided by sulcus terminalis. The anterior portion contains lingual papillae, including filiform, fungiform, foliate, and circumvallate papillae. These are four kinds of papillae present on our tongue. Each type of papillae has unique structure and functions, contributing to the tongue's ability to manipulate food and perceive taste. Taste buds are present in some papillae, allowing gustatory functions as well. Okay, starting from filiform papillae, these are thread-like, most numerous, no taste buds, keratinize, facilitate mastication, and provide tactile sensation. I am just giving you the points for each kind of papillae, like how are they present, where are they present, and what's their morphology. So for the filiform papillae, they are thread-like, most numerous, no taste buds present, they are keratinized, facilitate mastication and provide tactile sensation. For fungiform, fungus-like, okay, mushroom-like, scattered among the filiform papillae, contain taste buds on the dorsal surface and appear as red dots. Foliate papillae, leaf-like, located on the lateral posterior margins, contain taste buds in their epithelial folds, more prominent in children. Circumvallate papillae, large dome-shaped, located in the anterior sulcus terminalis, surrounded by circular sulcus, contain numerous taste buds, and von Ebner secretes serous fluids into this sulcus. Okay, here's this one question. What type of salivary gland, what's the name for salivary glands present on the circumvallate papillae? So the name is von Ebner glands and they are serous in nature. Okay. Types of papillae, I have given you the summary for all types of papillae in the earlier slide. Here are the histological diagrams for your filiform and your um, fungiform papilla. As you can see, the fungiform is mushroom-like. It is mushroom-like in shape, whereas your filiform papilla, which is keratinized, is thread-like appearance. Okay. Now we are entering into the taste buds. As we studied, many of the papillae contains taste buds for a special sensation. Where are they present and how are they present? Let's go. Let's study about them. Foliate papillae, covered by non-keratinized epithelium with taste buds located in the lateral walls. For foliate papillae, they are present in the lateral walls and the perception is on the sides of the tongue. For fungiform papillae, they have non-keratinized epithelium with taste buds on the superior surface. They are on the superior surface, enabling taste detection on the upper surface of the tongue. Okay, this foliate was on sides, fungiform is on the superior. Filiform papillae characterized by keratinized epithelium and there is an absence of taste buds, primarily serving as a mechanical function. Okay, filiform papillae does not have any taste buds and it only and only has mechanical function. Circumvallate papillae display keratinization on superior surface, opposite to the fungiform papillae. Okay, where taste buds were present on the superior surface, it has taste buds on its lateral borders, contributing taste perception. Taste bud structure and their distribution. Specialized receptors, these are specialized receptors. Where are they present? They are present on the lingual papillae, soft palate, pharynx, mucosa, ensuring their comprehensive taste and detection. What are their dimensions? 50 to 80 micron in length and 30 to 50 microns in diameters, forming barrel-shaped and spindle-shaped structures. What are the shapes? Barrel-shaped and spindle-shaped structures. What are taste pores? Atypically or typically the taste bud on the upper region will have a small pit of 2 to 5 microns, which facilitates interaction with the taste molecules. Here you can see in the above image, see here in the above image, you can see a typical pore or known as the gustatory pore. Taste sensations and taste regions. We have four tastes, typically five. Umami is a taste of proteins. But the four main tastes we have is sweet, salty, sour, and bitter. We have been studying this from our early age, and this slide like shows where the salivary, like where the papillae are present, and on those papillae where like we did study where those gustatory pores are present, gustatory glands are present. So according to that, the tastes are distributed. Sweet, primarily detected on the anterior tongue, contributing to the perception of sweetness. Salty, also sensed on the anterior tongue, enabling the detection of salty flavors. Sour, detected on the lateral tongue, allowing for the perception of sour taste. Bitter taste, sensed in the region of circumvallate papillae, contributing to the detection of bitter flavors. Intergingival junctional epithelium and attachment structure and basal lamina. The junctional epithelium attaches to the gingiva to the tooth surface derived from reduced enamel epithelium of the tooth germ. Structure, it consists of flat cells aligned parallel to the tooth surface, increasing its thickness from apex to the crown, and basal lamina attached to the enamel cementum by an internal basal membrane and to the connective tissue by external basal lamina. Now we'll come to the lip histology, mucocutaneous junction. So there are three main parts of our mucocutaneous junction. There's a transition zone, vermilion zone, and intermediate zone. What is a transition zone? The mucosa of the lip represents a transitional zone between the outer skin and the inner oral mucosa. In this zone, skin appendages such as sweat glands, hair follicles are typically absent, with the exception of a few isolated sebaceous glands that may be present. These are known as the Fordyce's spots. If the sebaceous glands are present on your mucosa, these are known as Fordyce's spots. What is vermilion zone? Vermilion zone is the red part of the lip, is covered by a thin orthokeratinized stratified squamous epithelium. This area is highly vascularized, giving it the characteristic red color, and it is also rich in sensory nerve endings, making it sensitive to touch and temperature. Intermediate zone, located between the vermilion border and non-keratinized lapel mucosa. The intermediate zone is covered by thin parakeratinized stratified squamous epithelium. This zone provides a gradual transition from the keratinized outer lip to the non-keratinized inner mucosa, adapting to both external and internal environments. There might be a question in few people's minds that I did mention earlier that lip is non-keratinized, but I'm here saying it is orthokeratinized, but it is a zone. Vermilion zone is orthokeratinized, intermediate zone is parakeratinized, but beyond that, the labial mucosa is non-keratinized. Key takeaways from this section of our presentation. Papillae, taste buds, and dentogingival junctions. What are papillae? Different papillae exist distinct keratinization patterns and taste bud locations, influencing our taste perception. Taste buds, they are specialized receptors distributed across the oral cavity, enabling the detection of various taste sensations. Then comes your dentogingival junctions. The dentogingival junction is a critical area where the oral mucosa meets the tooth surface, requiring careful attention to prevent inflammation and damage. Okay. Oral mucosa, a comprehensive overview. Oral mucosa is a specialized tissue that lines 80% of the oral cavity, serving both as protective barrier and sensory interface. It is significantly across the regions of the mouth, optimized for specific functional requirements. Okay. Now, on the basis, I did tell you there are three types: mucosa, lining, and specialized mucosa. We have discussed specialized mucosa. Epithelial layers, we have discussed all the four epithelial layers. Structural characteristic, thickness, it varies from 190 micrometer to 580 micrometer, contains 40 to 50 cell layers in the thick regions, and turnover rate is 5 to 7 days. Functional significance, the oral mucosa performs five critical functions, that is mechanical protection, barrier formation against microorganisms, immune defense containing over 100 million immune cells per centimeter square, Sensory reception through specialized nerve endings, thermoregulation via rich vascular networks, approximately 40% more blood vessels than skin. Additional details for discussions can be regional variations in the epithelial thickness and keratinizations, role in salivary gland distribution, and importance in wound healing and tissue generation. Okay. Lining mucosa. What is lining mucosa? We did study that there's three-pointer differentiation: masticatory, lining, and specialized. We have discussed the specialized mucosa. Now we are discussing the lining mucosa. Where is it present? Soft palate and ventral surface of the tongue. The soft palate contains non-keratinized specialized squamous epithelium containing 50 to 20 cell layers. Notable features include extensive vascular supply and dense fibers of sensory nerve endings. And there is also a presence of abundant adipose tissues. Okay, there is a lot of fat deposit. Then comes your ventral surface of the tongue. The ventral surface features notably the thin epithelium with distinct features, non-keratinized stratified squamous epithelium with 10 to 15 cell layers. Structural components include basal membrane complex, prominent desmosomes, high glycogen content. Lamina propria features short papillae, type 4 collagen-rich basement membrane, elastic fiber network, and specialized features such as dense capillary network, numerous mechanoreceptors, and small mucous glands. Lining mucosa, again, where is it present? Floor of the mouth and alveolar mucosa. We have studied about labial mucosa and buccal mucosa earlier as well. Vermilion zone we have studied. What is the vermilion zone? What is the intermediate zone? We have studied it before over here. It is from the mucocutaneous junction, the vermilion zone and the intermediate zone. You can just take a screenshot if you like. It is a small, like you can read through it and you can take a screenshot of this and this if you want further details for lining mucosa of labial and buccal mucosa. Here is for vermilion zone and intermediate zone. Okay. Moving forward, masticatory mucosa. What is masticatory mucosa? It is present on a gingiva and hard palate. Gingiva features a thick orthokeratinized or parakeratinized stratified squamous epithelium with surface stippling. We have discussed what stippling is. It is the orange peel appearance on the surface of the gingiva. It is present due to deep retipegs. The epithelium contains 50 to 20 cell layers, including 4 to 5 layers of keratin. Long, narrow connective tissue papillae extend into the epithelium, and dense collagenous connective tissues. Contains fibroblasts. Vascular networks include elongated capillary loops with 8 to 12 anastostomes. This is like very, if you are very nerdy, I've added like small details from books. So you can just take a screenshot and could like flex on your friends. Hard palate characterized by thick orthokeratinized stratified squamous epithelium arranged in transverse palatine ridges known as rugae at 2 to 3 intervals. We do palatorugoscopy in our department of oral pathology. So it is basically like fingerprints but for your palate. It is a part of forensic odontology. Features prominent ridges and long papillae. Dense connective tissue layer is present and type 1 collagen with abundant fibroblast. Vascular supply includes short capillary loops and numerous mechanoreceptors are present. Basement membrane which measures up to 1.8 to 2.2 micrometer with high concentrations of type 4 collagen, and it comprises of 40% of membrane composition. Specialized mucosa, dorsal of the tongue surface, we have studied it. There are papillae present over there and taste buds present, and it gives you the special sensation, hence the specialized mucosa. Okay, we did discuss this earlier. What are keratinocytes and non-keratinocytes? We studied that 90% are oral mucous membrane is comprised of 90% keratinocytes and 10% non-keratinocytes. So basically, there are three types over here. We are studying melanocytes, Langerhans cells, and Merkel cells. What are your melanocytes? These are neural crest cells in origin. They are similar to your stem cells. They can proliferate into any types of cells. But over here, we are studying their origin as melanocytes. Located in the basal layer, contain melanosomes, transferred to keratinocytes, involved in pigment lesions like oral melanotic macules, nevi, and melanomas. Langerhans cells, bone marrow origin. Okay, Langerhans cells are bone marrow in origin, migrate to the epithelium. From bone marrow to the epithelium, dendritic cells and Burbick granules are present. Part of malt and salt recognize and process antigens. Then comes your Merkel cells, disc-shaped, terminals by myelinated fibers located in the basal layer and sensory respond to touch. Excuse me. Okay. Three types of non-keratinocytes we have discussed over here: melanocytes, Langerhans cells, and Merkel cells. Inflammatory cells present in our oral mucosa. Okay, in normal mucosa, is a presence of inflammatory cells as we studied because it also acts as an immune barrier. So what are the key inflammatory types of cells present? Those are lymphocytes, PMNLs, polymorphonuclear lymphocytes, and your mast cells. Distribution, spatial distribution, higher concentration in basal layers, suprabasal layers as compared to superficial layers. Migration patterns include cell enter through the basement membrane utilizing the specific addition of molecules. And then there is a functional features that release various inflammatory mediators include cytokines, chemokinins, and growth factors. And that's for all of your oral mucous membrane. I hope I was able to grasp your attention or at least give you basic information on the oral mucous membrane. It is important for us to study the oral mucous membrane as uh, further you have to diagnose something like oral lesions, pre-malignant lesions. You need to know the general composition of your oral mucosa. And if you don't know your oral mucosa, you won't be able to differentiate what's a dysplastic feature, what's a non-dysplastic feature, what are the different types of layers present, and like what's wrong with a certain type of mucosa. If the layer is not keratinized, how like it's gonna affect a person. It's all in your oral mucous membrane. It is one of the most key important chapters, and I hope I was able to cover everything. My teacher who taught me this, Dr. Gaurav Sapra sir, I would like to thank him for like he was there for me to teach me this topic in so much detail that I had no issues in my third year in oral pathology. It is one of my favorite subjects, and I hope you have a great day. And thank you.